I think we can do it as an outpatient. I'm just saying, could you really translate this to a community practice as they do outpatients? I think that was the point I was trying to make. I mean, I think we can, offer this and sometimes execute on it. A lot of patients end up in the hospital, but we have systems in place that is not such a big deal. But when people say, "Oh, this is going to go into community practice," that's the outpatient thing. I think it's different.
I mean, you need an infrastructure, right? I mean, you need an infrastructure in place and allocation of resources from your institution to carry it out successfully. If you already have an outpatient transplant program, it's not difficult to adapt and adjust. But you need things that a lot of places have already, like a ability to provide local housing and transportation, and then the ability to see patients every day on an urgent basis. And it'd be great if you could, have a crash bed or two in the hospital when you have outpatient and avoid the emergency room, or you have your oncology specific emergency room. I mean, every place does it differently based on volume and the programs they have in place, but it does take infrastructure. And that's why I agree with Rob that it's hard to believe it'll be done in the community, at least with the constructs we have right now.
I can certainly speak to that as being at a center that does not have an outpatient transplant setup. And so, like Eben just said, without that, we couldn't do CAR T cells outpatient. They really require the same kind of infrastructure, and we just have never had the space and personnel figured out in order to do outpatient transplants. And likewise, we've not even discussed outpatient CAR T cells at this point.